Hello, informed humans, and welcome back to the show that keeps finding new and increasingly sophisticated ways to explain why the most important conversation in aesthetic medicine is the one nobody is having at the appointment. You are listening to the AI avatar of Dr. Irina Lazuk, dermatologist, skin scientist, and the woman who is about to tell you something about injectables that your MedSpa's intake form has never once asked about. Dr. Lazuk is not with us today because she is currently at a closed-door aesthetic medicine summit in Milan, Italy, having accepted an invitation to present on what the organizers described as the future of tissue-informed injectables. She delivered her presentation on day one. It generated what attendees are calling the most uncomfortable and most necessary conversation this conference has ever produced. She has since been asked to extend her stay, moderate 2 additional panels, and apparently rewrite the summit's closing statement entirely. She has agreed to all 3. We are not surprised. We have sent a later flight. She has not confirmed it. We have made our peace. So, you have the avatar. And today we are talking about something that is genuinely changing how the most thoughtful practitioners in aesthetic medicine think about injectables, and that almost nobody explains to patients before they sit down in the chair. We are talking about what happens inside the tissue before, during, and after injectables are placed, and why that internal environment, not just the product, not just the technique, quietly determines whether results look natural and last, or look slightly off and resolve unpredictably. Let us start with where the conversation usually lives and where it needs to go instead. In communities like Alpharetta, injectables are no longer a secret. They are normal. Botox at lunch, filler before a major event, biostimulators as part of a maintenance plan. The question has shifted from whether to when, and that normalization is not inherently a problem. The problem is that as injectables became routine, the conversation about what makes them work well has not kept pace. Most people walk into an injectable appointment thinking about symmetry, volume, lines, lift, specific concerns they want addressed. Almost no one thinks about inflammation. And yet, inflammation quietly determines how tissue responds to every injectable placed beneath it. Here is what low-grade inflammation actually does to injectable outcomes. Bruising becomes more likely, swelling lasts longer, filler integrates less predictably. Neuromodulators, the Botox family, may diffuse slightly differently than expected. Biostimulators like Sculptra may trigger more exaggerated responses than intended. None of this is dramatic, none of it is obvious, but subtle differences in tissue behavior compound into visible outcomes over time. And here is the part that makes this genuinely complicated. Most of the inflammation that matters is not obvious. It does not look like irritation or redness or an active flare. In high-performance communities like Alpharetta, where people are balancing demanding careers, outdoor athletic lifestyles, active skincare routines, frequent sun exposure, and regular aesthetic treatments, low-grade inflammation is common. It feels normal. It presents as mild dehydration, occasional stress breakouts, skin that seems a little reactive without clear reason. Biologically, it is changing tissue behavior. Injectables do not exist in isolation. They exist within a living environment that is vascular, immune active, and constantly responding to signals. When that environment is stable and calm, results are smooth and predictable. When that environment is reactive, the tissue may swell more, feel firmer longer, or remodel unevenly. The product is fine, the technique is fine, the environment was not ready. This is especially important with biostimulators like Sculptra, because these treatments rely on controlled inflammation to stimulate collagen production. They are particularly sensitive to baseline inflammatory tone. Controlled inflammation and chronic inflammation are not the same thing. When the baseline is already elevated, the signaling environment becomes less precise. the collagen response becomes less organized, results become less predictable. There is also a barrier health dimension that almost never gets discussed before injectable appointments, and that Dr. Lazuk considers genuinely critical. When the skin barrier is compromised, even subtly, transepidermal water loss increases. Increased water loss raises tissue reactivity. Elevated reactivity increases inflammatory tone, and even though injectables are placed deeper than the epidermis, the skin above them matters enormously. Healing, bruising resolution, swelling duration, all of these are influenced by what is happening at the surface. This is why intelligent sequencing is not a luxury. It is physiology. In Alpharetta, it is very common to see people combining laser treatments, microneedling, chemical exfoliation, active retinoid use, intense workouts, and sun exposure, often in the same week as an injectable appointment. None of those individual things is inherently problematic, but stacking them too close together creates an inflammatory load that the tissue must process. And injectables placed into that environment will behave less predictably than injectables placed into calm, hydrated, well-supported tissue. Sometimes the most intelligent injectable appointment is the one postponed for 2 weeks. That level of restraint is rarely advertised, but it is increasingly what separates routine cosmetic care from biologically informed aesthetic medicine. Now, let us talk about something else that gets conflated constantly, and that confusion drives a significant amount of dissatisfaction in aesthetic medicine. Preventative injectables and corrective injectables are not the same thing. The products may be identical, the procedures may look similar, but biologically and strategically, they are completely different approaches. Preventative neuromodulation, what some call baby Botox or microdosing, is designed to soften repetitive muscle contraction before lines etch permanently into the dermis. The goal is modulation, not freezing, preserving animation while reducing the mechanical memory that creates permanent creases over time. This works with youthful tissue elasticity. It is subtle by design. And in professional environments where expression and confidence matter, that subtlety is not a compromise. It is the point. Corrective neuromodulation is different. Lines are already structurally established. The muscle has been contracting in the same pattern for years. The skin has adapted to that pattern. Correction may require slightly higher dosing and will still take time because it is working against accumulated mechanical memory, not preventing it from forming. The same distinction applies to filler. Preventative filler is rarely about adding visible volume. It is about preserving facial balance, subtle cheek support, early temple stabilization, small adjustments that prevent the cascade of compensatory changes that occur when structure gradually declines. Corrective filler involves restoring areas that have already experienced fat pad descent, bone remodeling, and collagen loss. The quantities are different, the technique is different, the expectations must be different. Many aesthetic complications originate not from product choice or technique, but from mismatched intention. Preventative treatment evaluated through a corrective lens will always feel disappointing, even when the outcome is technically excellent. And then there is the third category, the one that is reshaping how the most forward-thinking practitioners in this field think about aesthetic medicine altogether. Tissue longevity. If the first era of injectables was about smoothing lines and the second era was about restoring volume, the era unfolding right now, including right here in Alpharetta, is about tissue longevity. Patients are no longer asking only how they look right now. They are asking how their face will age over the next decade, and that question changes everything. Traditional fillers add volume. They are excellent tools, but volume alone does not rebuild collagen architecture, improve dermal thickness, or restore elasticity at a cellular level. Biostimulators do something different. They do not fill, they signal. They encourage the body's own regenerative machinery to rebuild structure gradually, structure that integrates into tissue rather than simply occupying space. When biostimulators are sequenced correctly, paired with appropriate neuromodulation and occasionally subtle structural filler, the face maintains integrity rather than chasing lost volume repeatedly. The change is less obvious at any single appointment, but more profound over time. Regenerative therapies like PRP and exosomes amplify this effect, not by replacing any of these treatments, but by optimizing the environment in which they work, reducing inflammatory tone, supporting vascular signaling, improving recovery quality. When timed correctly, they make everything else work better. When stacked aggressively without sequencing, they increase variability. Longevity is not about doing everything at once. It is about rhythm, and rhythm requires restraint. Here is the nuance that Dr. Lazuk considers the most important insight in this entire conversation. Longevity care often looks subtle in the present. The reward is visible 5 to 10 years later, when the face has maintained coherence instead of fragmenting into isolated corrections. When friends ask if you have been resting well rather than what you have had done. When aging feels like a gentler process because degradation has been reduced and regeneration has been supported from the beginning. Injectables in 2026 are not cosmetic events, they are biological interventions, and when they are approached that way, with inflammation respected, timing considered, tissue health prioritized, and restraint treated as a feature rather than a limitation, they integrate into a larger ecosystem of skin health that produces results that hold, look natural, and age gracefully alongside the person receiving them. Not louder, smarter. Before we close, everything you just heard is purely for entertainment and educational purposes only and does not constitute medical advice, a treatment recommendation, or a clinical assessment of your individual anatomy, inflammatory baseline, or injectable candidacy. All injectable treatments require professional evaluation by a licensed physician who can assess your specific tissue environment, goals, and timing before any recommendation is made. Please consult a qualified dermatologist or aesthetic physician for personalized guidance. Dr. Lazuk and our team at Lazuk Aesthetics in Alpharetta are available to discuss whether this approach is right for you. Dr. Lazuk herself will return from Milan as soon as the summit proceedings conclude and someone confirms a flight she will actually be on. May your skin always glow as brightly as your smile.